Good day, viewers and listeners, and welcome to the COVID-19 update. Today, we're speaking with the Minister of Health, Dr. Frank Anthony, about the measures in place to better prepare Guyana for future pandemics.
So we are working at different levels. On the international level, we are working with the WHO, with PAHO, in the discussions to develop a new instrument that probably would strengthen the International Health Regulations 2005. So there have been discussions on either strengthening that particular instrument that has been in existence or to develop a new instrument altogether. So we are part of those discussions, and from those discussions, I think we'll see changes at the hemispheric level and obviously at the country level. In Guyana, here, we recognize some of the challenges that we have had with COVID. So we would have had to build surveillance capacity so that we can detect the disease, laboratory capacity so that we can diagnose the disease, and then, of course, to be able to treat the disease. So whether it's outpatient or in a hospital, we had to develop those capabilities. And then obviously to have vaccines which can help to prevent. So moving forward, what we have done and what we are working on is how to better strengthen our surveillance system so we can have pretty much like an early warning system where if there's anything happening, we'll be able to detect it early. And having that information early, we'll then be able to take the necessary measures in terms of limiting the spread of the disease. We have also been working on developing our laboratory capacity. So our laboratory services now are much better than they were 2 years ago. We have lots of capability in terms of doing PCR, which is a very important test as it regards to COVID-19. And in future pandemics, depending on what it is, I think using PCR techniques would obviously play an important role. So if we strengthen our capacity to use PCR and to have these capacity at the regional level, it would help us in future pandemics. Building a hospital infrastructure where we are capable of managing infectious disease patients is important. And that capacity doesn't have to be only in Georgetown. We have to have this capacity at the regional level as well. And so the work that we are doing, the infrastructure works that we are doing at our various regional hospitals, we'll be able to cater for patients with infectious diseases. We have also been able, over the last 2 years, to strengthen our cold chain and to be able to store vaccines at different temperature ranges. Previously, Guyana only had the capability of storing the 4 to 8 degrees vaccine. So during this pandemic, we were able to improve that to do minus 20 degrees Celsius and to do minus 70 degrees Celsius, which was a requirement for the Pfizer and Moderna vaccines. So we have built that capability, and so that is an additional way in which we can prepare. Additionally, we'll have to work on strengthening our human resource capacity. So this would be ongoing work that we'll be doing. We'll have to do much more training, have more people trained in the area of infectious disease and its management. So that would be ongoing work that you would see us do over the next couple of years. But I think with the way that we have responded over the last 2 years, we have been able to build a lot of capacity, but we are not going to be static. We are going to continue to work in developing all of these areas. We are spending a lot more time now focusing our attention on the rehabilitation of these patients. And in June, the first week of June, we'll have a training for physicians, a lecture that would be done by one of the top experts at Mount Sinai. And this would be done for Guyanese physicians. So we are hoping with the training that a lot more of the medical doctors would become familiar with long COVID, and hopefully they'll be able to detect it and to offer proper treatment for these patients. So right now we have 142 active cases, and over the last 24 hours we did 310 tests, and we've had 3 positives. We have also in hospital 5 persons, 2 at the Ocean View Hospital, 1 in Maikoni, and 2 in New Amsterdam. So we are going to continue to monitor. It is not unexpected because we have seen increases in cases in other countries. So while we would have had a good period where numbers were pretty low, we can expect with rigid testing that we'll see cases. So people have to take the necessary precautions.
You have been watching the COVID-19 update for today, May 9, 2022. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. I am Shania Gonzalez.